we are ready. So, Jessica and Ronnie, welcome to SPRY podcast. You are a most featured guest and also the most welcome guest. I think we've been looking forward to this for so long, and I'm so happy that you are able to join us. So I will not go through further introduction, but I will let you both to introduce yourselves and tell us a little bit about the Athlete Restoration Lab. So.
Yep. Thanks for having us. We really appreciate you having us on. Yeah, like you said, my name is Ronnie Pawley. I'm the clinic director with Athlete Restoration Lab, our rehab. We like to shorten it for ease. We specialize in athletes. Our bread and butter, our main focus is dealing with high-level athletes, whether that be training, getting guys ready for the combine, for NFL offseason, or even your elite level high school players. So we kind of see all age groups and truly focus on how technology and PT can kind of coincide so that we can truly provide the athletes with everything they need. Objective, data-driven objective measures is kind of our goal.
And my name is Jessica Wulke, and I'm also a sports physical therapist. My role here, outside of just treating our high-level athletes, I'm the director of athlete integration. So my role is truly kind of pulling our our sports performance partner and ourselves together. So there, like Ronnie was saying, we use a lot of data to help kind of program both the PT side of it as well as the sports performance side. So we really use a lot of the data that we get or the data that they get in their testing and pull it together to really give that athlete that full package. And we also help with even using that different markers or different measurements to even decide what type of recovery modalities do we use for our athletes? Are they getting different types of massages, any of those types of things? So I help kind of with that athlete journey from start to finish, not just from physical therapy, but with all of our partners.
No, that is terrific. And I think considering the level of professional athletes and the level of performance that your clients are working with, it really is important to have a discriminant way of looking at these products and these resources to find out the proof in the pudding, right? Like what sinks and what actually floats. So is there a way that you guys are screening these tools, the wearables, assessment technology that gives you both for the data precision, but also for the data that you can best apply towards sports performance? So is there a stratification criteria that you guys use for that technology?
Yeah, so I guess a little clarification on that question. Are you saying like how do we decide what technologies we're using?
Yeah.
Yeah, so I think it's a lot of it's a little bit trial and error. We go with technologies that we're like, okay, this seems to fit our objectives. It seems to coincide or align with our vision, and so we'll utilize it. And but it's really truly trial and error, especially in the technology field where there's a new technology every day. So being able to get research backed technological data is hard because I think a lot of times, like if we're waiting for the research to come out, well, there's 3 new technologies that have already come out. So a lot of times I think it is truly that trial and error piece. But ultimately what it comes down to is, does this piece of technology give us what we're looking for? Is it simplistic to use? And does it really fit the criteria that we need to get our athletes back to their highest level?
And I think another thing that we used when deciding which technology we use in the clinic is also what are other teams using. So it makes it that it's very easy for us to talk apples to apples to teams when an athlete goes back to that team. So for example, if we're using a Nord board and we're testing their hamstrings, it's very easy for that team to tell us, hey, this is what they tested when they left the team. Perfect. We can test that, and our test reliability and retest is very easy and reliable. And so then we can test them. We can go through their PT. We can go through their sports performance. We're talking the same language. And then when they go back to their team, we're able to say, here's the progress. Hey, we know that you've done this test. This is the test that we did again when they're going back to it. And it allows us to have that good cohesive communication with the different teams when they're sending the athletes to us.
I think that is right on, right at the point of clinical data that we're collecting. It can both be a uniting factor if we're speaking the same language, and it can also be a differentiating factor if we are not, where then you're really just so diverse in the type of narrative that you perform. So with that in mind, is there a piece of technology right now in your clinic that you can absolutely not live without? Is there any one piece of tech stack that you absolutely love, and why do you love it?
Yeah, you want to take this one first?
I think I think what's really important for us that we've kind of discovered is that there's not one true test that you're like, this is the best test for an athlete, right? It's kind of, as you looked in research for an ACL, right? We know that there's a battery of tests, and really truly a battery of tests is going to give us an answer of who's at risk, what's breaking down, those types of things. And so I know that we always say, hey, a whole battery of tests is always going to be the best for the athlete. But I think if you told me I had to pick one thing, and for our high level athletes that we're seeing, especially like our receivers, our linebackers, people that are making these cuts, sprinting, change of direction, I would probably say the Nord board. And looking at eccentric hamstrings, because we see a lot of soft tissue injuries. We see a lot of challenges with, again, that eccentric hamstring. And we know that there's a lot of research out there to support that, if there's this deficit or if they're not strong enough, the risk of injury is rather high. And there's a lot of research to support that. So I would say that that's probably the one that's backed by the most amount of research. And it's very easy for us to discuss with other teams, because there's a lot of teams that use this. Like, we know that there's one NFL team, they do this every Friday. They do a Nord board test every Friday with every one of their athletes during the season. So they can kind of check in with how are those hamstrings doing. So again, it's an easy way for us to talk to the teams because they already have baseline. But I think the test that I do the most with athletes is the anterior step down test, which doesn't require any technology. So I think we kind of see both sides, where we know that technology is so important, but then there's sometimes that test, like that tried and true anterior step down test that looks at kind of how does that full body move with a step down is very valuable to us.
Yep. Yeah. And, I think to Jess's point, it would be really hard to pick one specific, but ultimately what it comes down to for me is I want a piece of technology that, one, I can pull up very simply. I don't need to load into something. It's not going to take me a long time to get it ready for the athlete. And then once we're done testing or doing the exercise, I can simply show it to them. I can show them one data set and it's like, boom, this makes sense. This is why we need to work on this, or this is how you did. A piece of equipment that I really like is the Beyond Power equipment. And I like it because it's so versatile, but at the same time, it's a one-step shop. You can do eccentric loading, you can do isokinetic loading, you can do isometric loading, you can do all these different types of loading, and it's all in this one device. So anything that's versatile and easy to use, I'm like, oh, sign me up, because the last thing I want to do is be using my brain power to figure out how to use this piece of technology when I should be focusing on the athlete.
And I think it's important too, when the athlete understands how does this translate to what they do on the field. Because I think we could have the most amazing test or the most amazing technology, but as soon as they don't feel that this is beneficial to what they're going to be out there doing, I think we lose the athlete. And so I think that that's also what's really valuable is, can we explain it to them? Is it simple enough? Is it translatable enough that they understand, okay, when they use the Beyond Power or when they use a Nord board, like, I understand why this is important to my sport. I understand why I need to do this. And then they tap in more and truly are engaged more with their test or with their exercise because they understand the why behind it. And so I think that that's also really important is, do we as clinicians understand the why? But does the athlete and the patient understand the why?
Yeah, 100%. I think that what technology does is it puts objective into subjective, right? So
Yeah.
once you have the data, it's a conversation starter. But what you were referencing, Jessica, is right on too, where like at a rudimentary level, our clinical observation also serves a very important, powerful tool to start this analysis, right? So has there ever been a point where that subjective feeling, especially for an athlete who is just itching to get back on the field, but you can use an objective data to tell them that they have a different level of readiness and they potentially are not there, or that data tells you that they have a higher probability of an injury in the next 3 to 6 months based on that poor left to right symmetry or poor hamstring motor control, right? So how do you manage this conversation where you have this objective data that tells you one thing, but then subjectively the athlete just wants to get back on the field?
I think we run into that. The greatest injury that we run into that with is the ACL, right? I think in an ACL, especially when we look at the 5-month mark, the 6-month mark, this is when they start feeling great. We're running in rehab. We're starting to introduce cutting. They feel great. And in their mind, there was other NFL players that went back at the 6-month mark, but we know in research, we know that it truly is 9 months is where we need to be at. We know that the research shows 2 things. We know timeline, 9 months, and we know quad strength. Those are the 2 things that have been supported in research over and over and over again. And so we start right away, right when we see them initially, we start that education at month 0, right? So that then when they start to feel really good, we tell them like, this is great that you feel good, but here's still these numbers that are still going to show this deficit. And if you go back, even though you feel good, objectively, these numbers don't match. And that puts you at an increased risk for either tearing the other side or re-injuring the same side. And is that worth it? And a lot of times when you spin it that way and you say, hey, do you really want to miss another 12 months or another season? Like all of a sudden that puts it in perspective for them. And I think, again, when you don't go off of just feeling, right? Because a lot of times people feeling wise, they're going to feel ready before they're truly ready. If you give them objective data, it kind of takes away you being the bad person. And you kind of say like, here's the numbers. We know that this is the numbers that you need to do to be able to do X. Okay. Once you get to those numbers, then we can do the next step and we could do the next step. So we always give them like goals for each of the 3-month mark, the 6-month mark, the 9-month mark. So they know what they're reaching for. We don't just say, okay, in 9 months, you go back. Okay, here's how you get to start running. Okay, here's how you get to start cutting. Okay, here's when you get to return to sport. And we give them those numbers. So again, it's not off of feel. And I think when you start to give objective numbers, then they buy into it more, right? Because then they get what they're trying to, their goals and what they're trying to get back to. And they understand it. And I think when you give them data, the guys are, or at least our athletes are so driven by data, more so than you think they are. And so as soon as you sit down and tell them, okay, here's the risk, or here's your numbers, or here's your goals, or this is the deficit you want to be within, they eat that up. They love that, right? Because it's not just, oh, you feel strong with the manual muscle test, or you look strong, or that squat was good. It was like, no, you jumped this amount of force, or you had this amount of deficit when you did a Nord board. So I think that helps for them, for their progress.
Yeah, and I think, you have to know the injury and the athlete type you're going to deal with. And so I found that like if you get on top of it early and you kind of set that expectation, hey, here's where we're going to be every step of the way. 1, it gets that patient buy-in a little bit more. And 2, it just helps them to see like, oh yeah, he said I'm going to be here. I feel great, but he knew that was going to happen. So they're going to trust along that process a little more. And that's why one of the things I'll tell my athletes is I have 2 jobs. My first job is to get you to feeling better. And my second job is to actually get you back on the field. And so And I differentiate that. I tell them, hey, you're going to feel great, but you're not going to be ready to go on the field. And that's where technology comes into play and really helps us to kind of meet the goals of okay, we need you at this leg symmetry index. We need you at this symmetry between legs. We need you at this strength to be ready. And then we can back it up with, this is what the data shows. Just like Jess said with ACLs, we know that if they go back prior to 9 months, their injury risk goes up greater than 5 times versus someone that's never had an ACL injury. And we know that between 9 and 12 months is that range of, okay, the more time we wait as we're getting your strength back, the better off your chances of not having that re-injury. So I think it's just, one, it's using technology and using data to drive why you're saying these things versus just, well, I just don't think you're ready, because that never goes over well for an athlete.
Yeah, right. But especially what you guys are referencing, that the 9-month period is empirically driven, right? It's a number that's been shown to be consistently a big predictor to re-injury for ACLs. But then if you create a roadmap and you say at 3 months you should be here, at 6 months you should be here, then it gives that, like, it becomes more of a patient-centered or a client-centered approach, which is right on. So besides the 9-month benchmark, are there any other numbers that you wish people in our clinical community were more aware of and would follow more based on these objective markers?
Yeah, I think, I have a background in overhead athletes and work with a lot of pitchers returning from slap tears or Tommy John ligament repair. And I think we get, as clinicians, so caught up in the classic termination GERD, glenohumeral internal rotation deficit, and we get so caught up in that and don't pay attention to like the total range of motion and the other numbers and the kind of, you want to look at total range of motion versus GERD, because a thrower's shoulder is going to have oftentimes humeral head retroversion, which is going to allow them to go back into external rotation and decrease their amount of internal rotation in the first place. So like when we look at these numbers to get them looking symmetrical, it's not always ideal. Like, yeah, it makes sense for a lower body to be symmetrical, but upper bodies, when you have such a difference in the dominant side versus the non-dominant side, I think understanding the key differences in upper body injury versus a lower body injury is huge for people, because the body can't always just be perfectly symmetrical. It's I kind of say, like, it's you want to have that perfect asymmetry. So there's things, yes, we want to come into play, but when we're just trying to compare apples to oranges, it just doesn't always work.
And I think for lower body, we're continuing to look at isokinetic for the quad, and looking at, I think one of the things that we miss out on is, the ratio between quad and hamstring. And we kind of see it on both sides, right? If somebody has a hamstring issue, we don't work on the quad, and vice versa. If somebody is coming in for an ACL, we hone in on the quad so much we don't work the hamstring. And we see down the line as we start to return to sport, then they have either a hamstring issue, or a lot of times what's missed is a calf strengthening. And so if you're asking somebody to sprint, well, of course you have to have a hamstring and calf working. So I think we truly look at, and that's one of the things that we're really passionate about, is when we treat, we don't just treat the injury, right? If they tore their ACL, we're not just treating the quad, right? You're going to see that they're going to always get core. They're going to always get hips. They're going to always get their hamstring. They're going to always get their calf. And so when we're testing them and looking at those objective measures, we're truly looking at left versus right. And like he was saying, in lower body, we are looking at deficit left versus right. And we know that research, supports under 10%, but truly on these elite athletes, they're starting to show closer to 5%. So if we can even close that gap, but sometimes we're seeing, I just evaled an NFL guy that we saw almost a 26% deficit And this was 2 years out, right? And so, when you're seeing these large deficits, that obviously that puts them at an increased risk for injury. And again, we're not just looking at, just a timeline or just the quad, but truly looking at, we'll get out the force frame and look at the hips, and we'll look at the calf strength, and we'll look at landing mechanics and those types of things as well.
But right on. But the numbers don't lie, right? So I think that's such a good point of conversation. That like, dude, you are 26% deficit. Like, I know you won, guys, but there's a point of also advocating for them long term, not just having the short term vision.
Sure. Yeah. Yeah.
So then
I would say, like, I think that's a big piece, kind of to your question, is what do you wish, other data points that you wish people knew? And I think it's just data points in general. Like, I think a lot of times when you have someone returning, this guy got back on the field at 26% deficit, and by all accounts, I'm sure from a movement perspective, he looked great, because the human body, if it does any one thing well, it compensates well. So his body learned how to move, maybe not the most efficient way or the most longevity inducing way, in terms of like, he is probably at a higher risk of re-injury or another injury because of this compensatory pattern. But if someone had just looked at the numbers, like I think that was your hamstring guy.
Yeah.
If someone had just done a Nord board, it would have been a very simple, here is the data point that shows you're not ready. And then that gives the clinician a piece to, okay, I now know I need to work an eccentric hamstring to get that strength back. I mean, it's all about the theory of specificity for that. So I think just getting data points in general is maybe a lost art or maybe a never used art in the physical therapy world.
Well, yeah, and the standardization, right? So if you're using a Nord board, and you would assume that all the other cooks in the kitchen are using the Nord board, so the trainers, right? Like, then you are speaking the same language. You are speaking the same data points. You're speaking the same vectors of force and the angles of force and the volume of force. So then there's no getting around it. The problem is when you have the ambiguous subjective narrative of I feel or I want, but you being I think advanced trained clinicians, and you being armed with technology, you objectify your hypothesis by saying this data from Nord board justifies what I'm saying, versus like, I don't feel like it, right? But so then how do you manage this the cooks in the kitchen narrative of a lot of athletes will have more than just one clinician, more than just one trainer, more than just one strength coach, right? How do you create a shared narrative around data, but beyond, around this individual, so that everyone can stay on the same objective of getting this person better, getting this person ready to compete at a high level? So what's the shared narrative here?
Yeah, I think it's I mean, that's the key in the world of athletes for sure, is learning how to be collaborative. And if you're not collaborative in this world, you're one, setting your athlete up for not the highest level of success, but you're also not setting yourself up for success, because I know my strength in this realm is that I am very good at the rehabilitative side of strengthening. I know how to get someone back to their prior point, if not a little better. But when it comes to like the true like speed work, the skill work, those types of things, I know there are better people out there than me that do that. There's strength and conditioning coaches, all these other pieces of the pot. And so realizing, hey, here are your strengths, here are your weaknesses, and dropping your ego at the door. That's the biggest thing, is realizing like, hey, if someone says that they're seeing something, well, chances are they very well could be, and it's just not in your wheelhouse that you're looking for that. So, I think the more eyes oftentimes is helpful, but you just have to be all on the same page, and trust that your common goal is to get this person back to their best level. So I think it really comes down to dropping the ego and realizing that, hey, you might not be always the only right one in the room. Realize there's other right answers here.
And I think kind of to go along with that, communication is key. I think communication across the team, across sports performance, including the athlete, making sure that everybody is on the same page as far as goals, as far as timelines. I think that's when things start to get messy, is when somebody may be saying a different timeline than another person. Somebody may have a different goal than another person. I think that's when we start to kind of get a messy message. And so I think that's one of the things, again, that we do really well. And it's something I'm really passionate about and kind of in my role. And so a lot of times with our athletes, we'll talk on Sunday and we say, okay, Sunday, this is what Monday, Tuesday, Wednesday, Thursday, Friday looks like. This is how I'm going to program. Okay, this is how I'm going to program. Okay, if you see anything different, then this is how we'll modify. And then it's communication with the team. So as they're going through off season, so, a lot of these guys are playing all across the United States, but they come and stay in Dallas. And so each week we're communicating with the team and we say, okay, this is what they look like. This is our goal. What do you think? Do you guys have a different plan? Is there any different things that you're looking for by the time that they come back? Right. And then they go back to OTAs. And then guess what? We're going to get them back in 6 weeks. And then they're going to communicate back with us, say, hey, in the last 6 weeks, this is what we've worked on. Okay, great. We'll take it from here for the next 8 weeks. And there's a lot of back and forth. But I think as long as the athlete feels like everybody's on the same team, everybody's working for the same goal, I think there's so much trust in that team. And I think that's what's important. And it's like you said, as long as everybody's willing to not really be that top person, but work as a team, I think that's what's important. And I think that's what's so special about our team here, is there's not one of us that's trying to be that person, but rather we're all part of the team. And so each person is just as important. Our dietitian that does the nutrition, she sends out, hey, this is what their in-body looks like. This is what their scan looks like. Hey, we're trying to gain weight this week. Okay, perfect. This is what we need to work on in the strength side. Hey, we're going to up their lift this week. So, hey, they're going to need more protein. So that's all just, again, what are their goals for off season and how can we help them and how do we work together as a team? So I think that's what's so important. And then the athlete feels it. And they feel, okay, everybody's working to accomplish the goal for me. And they kind of feel like a one of one, even though there's multiple athletes here, they feel like everybody is working for them.
It's that domain expertise, right? Like, so you
Yeah.
think as you were saying, that you checking your ego at the door and actually knowing your strengths, but also knowing when to use the best available expert for that individual. So let's move a little bit then ahead and let's talk about the emerging technology. So there's a proliferation of artificial intelligence agents that are coming into the field. Do you think we will ever get to the point where there's going to be parts of rehab science that will be fully outsourced to artificial intelligence? And if so, what do you think are those parts that can be outsourced to artificial intelligence?
Yeah, I mean, I think just in the space of what SPRY is offering, the AI dictation piece, we've already been sampling it and getting to know how to use it and finding, okay, here's what it does well, here's where maybe the weak points are. But I think truly it's going to the opportunity to cut a PT's documentation in half, or to even where it's like the PT doesn't even have to write anything down. I think that's coming along the way very quickly. I think I was just telling Jess this morning, I was like, wait another year and it'll be perfected to everything. So yeah, I really truly think that's, if you ask any physical therapist or any person in the medical field, I would say, what's your least favorite part of your job? And most of the time it's documentation. So I see a world where AI truly comes in and integrates with the PT to truly learn the PT's patterns, how a PT evaluates, how a PT likes to say, to document what they're doing, all of these things, and it just basically flows in, listens into the PT and the athlete's conversation, and and it just has everything completed. I mean, to the point of the SPRY's AI system, we use it for basically every initial evaluation at this point. And from a subjective and objective data, yeah, there's maybe a few things I'm still having to move around, but it's getting the nuts and bolts of it. And, you know, where an initial evaluation after I actually complete it, you know, it may take me 20, 30 minutes more to actually write the note. I'm down to 10, 15 minutes just because half of my note has already been completed by the system, which is, I mean, to me, if you're trying to improve your work-life balance, that's where you get it. You get it from cutting away these things, the time-consuming things. And so to me, that's where that's where AI for sure needs to be implemented. You know, I think there's probably other areas that I'm just not creative enough to think about.
Yeah, and I think physical therapy is unique in the medical world in the sense that we spend, and especially in our world with athletes, we spend with our athletes 1 to 2 hours a day, 5 days a week. So we're with our athletes a lot, a good chunk of time. And so I think that when I think of AI, I think of it as truly valuable from a documentation standpoint, truly a way for us to get away from our computers, because we're there and we're running drills with them. We're running routes with them. We're putting our hands on them. We are making sure that they're doing the exercise correctly. We're very hands-on. So I feel like AI is so important for that. And I think for me, that's where I see the most value of it, because I feel in our world, we're a very empathetic career, right? And so showing empathy is truly important to each patient as they're going through probably one of the biggest challenges of their life, right? Are they going to be able to provide to their family? Are they going to be able to continue their lifelong dream? And here we are, if we're in front of our computer writing a note, how empathetic can we be? And so I think that that's where we see AI truly being hugely valuable to us. I don't know that I necessarily see it in the same way of like maybe in the medical world where you could replace maybe an urgent care doctor that could do screening, right? I don't know that there's a lot of, and for our world, I think that it is so hands-on that AI could maybe help some screening parts, but not truly treating. And I think that that's where we're unique, is how can we be creative in helping these little parts that take us away from our patients and truly allow us to be more with our patients, because that's what people love about physical therapists. And really, if you ask them, you know, when they have surgery, they see their surgeon for 15 minutes, you know, over a course of 6 months, and they're going to see us for hours at a time. And especially they'll spend the entire day here at the facility, right? Because they're going to see us for 2 hours. They're going to see their performance coach for an hour or 2 hours. They're going to see the dietitian for 30 minutes. They're going to see the recovery specialist. And so I think being able to provide them without sitting in front of our computer, but being able to listen to them and hear what they have to say, I think there's value for AI from that standpoint.
Yeah. It's a great liberator, right? So especially from it's like SPRY, which just liberates you from these low value tasks, which consume a lot of your time, but really don't add anything to the clinical out. And you're absolutely right, Jessica. We are such a hands-on profession that I think the essence of our care cannot be digitized. We'll continue to be clinicians. But there's so many different caveats of our trade that unfortunately over the last 20 years that have been inundated with these low value processes, right? That just sitting in front of a computer, taken away. And that's a big reason for burnout, is that we're so focused on things that don't add value to us or the patients, but are there. So I absolutely agree. It's a greatest liberator. Do you see a way that technology can also be then a liberator in collecting that data that we already are collecting through like the Nord board as a way of keeping maybe a central repository of all this data that can give you more of a, I guess in essence, a clinical decision support tool, right? Like once you crunch the data, it gives you more of an insight based on the statistics this individual is tracking in this direction, right? So creating like a little bit more of a objective recovery journey. Do you see any way that we can continue to evolve that part of the technological process?
Yeah, I think, and I feel like we have started to kind of do this with us with our spreadsheets. And again, I think technology will continue to improve this process, but with all of the data that we pull, so any of the technology that we use from Vault, any of the force decks, force frame, those types of things all get put into a spreadsheet, and it will be color coded green, yellow, or red. And then we have some therapists that will also do range of motion measurements, and those will be also green, yellow, or red. And so it kind of puts together a whole data set for the athlete. So then at the end, we kind of show them like, here are the things that are placing you at risk for injury, even if they're just coming in from like a screen perspective. So we do combine training, which is 8 to 10 week program. They come in and they may not be injured at all, or they may not think that they're injured, right? But we will go through this whole testing. They do a PT eval, they do a bodyworks eval, they do this technology eval, and then we put it all into the spreadsheet, and they can kind of see, hey, these are some red flags that we're seeing, right? And this is what we're seeing from data. And this is for the next 8 to 10 weeks. We're going to not only reevaluate in 4 weeks and then reevaluate again in 10 weeks, but here's kind of our roadmap and how we're going to go about addressing these things. And then we tell them the why, right? Because again, if they don't understand, why does it matter if I'm landing with this amount of force when I'm landing a jump? If that doesn't translate to anything for them, that they don't really care. And so really important that we sit down with each of these athletes and explain the why behind it. And then again, they feel like this program is specifically for them. And so we do that. And so we've been doing that with the athletes as they come in for off season and those types of things to give them a picture. And then it becomes really easy for any of the injured athletes. We'll get different numbers, and then it becomes easy for us to talk to the athletes, but also easy for us as performance coaches and PTs and anybody that's kind of doesn't work with the athlete regularly. They can pull it into this spreadsheet and they can see, okay, here's kind of the red flags for this athlete, or here's what they're working on, or here's still their deficits, or here's what their plan looks like. And so it allows us to kind of communicate across the board with all the different professionals. So I think as we continue to, it would be so nice if it just inputted automatically, right? And it just made it that way. And so I see that that's where it will go eventually. But we are very lucky to have kind of a sports science guy that went through and is able to kind of put different numbers as far as what's a green, what's a yellow, what's a red, and for each of the different numbers that we're getting from the Vault technology and from different range of motion measurements.
Yeah. Yeah, I think to that point, I think, there's definitely, and I think we see it kind of with Chat GPT already, where, we ask it something or we input something and it will pull up, oh, this is what data shows, or this is what research has shown. And so, I definitely see, a general workflow where you can input, okay, this is what I found on the Vault data sheet. This is what I got from the force plates. These are all these numbers. And it almost like does the work for us, where it's like, okay, based on this data set, here's where your athlete lands in terms of the standardized number. Here's what their injury risks, things like that, which I think could be more than invaluable in terms of just showing the athlete where they stand and just giving them a hard data point. But I think on the flip side, I think we have to make sure that we still understand as clinicians why, the why behind all of it. So I don't think, my fear would be that we get to a point where we just rely on the technology telling us what we should be doing, or what their risk is, versus already having kind of a formulation of, this is why I did this test and all these things. So I think there's got to be a balance in there. But yeah, I think in terms of data gathering, it could be hugely invaluable. Another huge time saver for sure.
Yeah, it's the human in the middle model, right? So the human has to be in the middle of all this data. But then, like, that's just the numbers. We're computation, the compute parts. We don't have to sit and crunch the numbers. We can outsource that to technology. But then potentially in the future, having this central operating system that can take on this data from Vault and from other wearables and give you a more granular appreciation for all of these, right? Right now, it's still a fractured system. So potentially there's going to be centralized repositories and companies that don't have EMR and have revenue cycle management, but also have this clinical data repository that can be all kept in the same place, right? So let's move to the last question then. And this one is a little bit more of a fairy tale question of how and where would you see our industry going forward if we were not limited by financial constraints or resource constraints? So if we had unlimited money and unlimited resources, how would you build a clinic of the future? And what would it look like? And how would a professional athlete be able to experience it? But also a professional athlete maybe on a high school team, right? Like, so what would that clinic of the future look like, independent of any constraints?
Oh man, I do. And I've been fortunate enough to like see some kind of like labs where they have moving force plates in the floors and things like that. So force plates throughout the entire facility where you could have your athlete running a drill, running a route, whatever it may be, and you can see at each point what their movement pattern looks like. Oh, on this one you put more force down versus the right side, and so that, along with like 3D motion capture throughout the facility, I think it would just be where at no point in the process of movement could we not come back and look at, okay, where did we break down here? So, I think it'd probably be my dream facility would probably inundate me with data. But I think that's where, like, the sky's the limit in terms of the more information you have for the athlete, the more likely you can really hone in on what their true dysfunction is and things. So, yeah, I think it would be force plates everywhere and 3D motion capture throughout the facility.
Yeah, I agree with that. I would love that. I think the other part of it for me would be, like you were talking earlier, the ease of it, right? Is this would be great to have all of those things. I think the ease of that, it would be so quick to just get that information, and it would be so quick to send that information to the athlete. And you would be surprised at how many athletes want to know these things and want to see these things and want to compare these from this week to 4 weeks from now to when they leave. What does it look like? Okay, what were my numbers last time? What did I have? What's the goal? And so being able to give them that information and being able to share that information for them, and them be able to have it on their phone or whatnot, and being able to see a picture that makes sense to them, I think to me would be more valuable than any piece of equipment, is just the ease of it and being able to communicate to the athlete. So I think, like you said, being able to capture when you're running drills and those types of things, that it's not a controlled, like, okay, you're going to jump up and you're going to jump down, because again, it's relatively controlled. Yes, can we see differences? Of course. But it's when they run a route and they get into those eccentric movements, what does it do? How does it change? What does their running pattern look like when they're off a treadmill, right? And how do we see those changes? That's one of the things that I love to look at is running pattern, is gait analysis, and how does that change? And it's hard to do when you're not on a treadmill because you don't have the space, right? And you can't necessarily do it at full speed when they're running a route or when they're changing a direction or they're reacting. So I think being able to see that in some space would be amazing. And then, like I said, the ease of it, right? If we could pull it all together and, like you said, have a company that does it all. So we do a test and they go and they do a morning long test and they do all the different tests, but then it all piles it together, and it's so easy because we can explain it. It's just a matter of like, okay, well, let's pull it up on this screen. Okay, now we're going to go over to this and we're going to pull it up on this screen. And then now, and so if they could all be centralized and be able to say, okay, this is your athlete profile and this is what it looks like. And these are your pictures and these are your videos. And now we're going to transpose this on top of this is what you look like 4 weeks ago. I think that would be amazing, because I think that's that's what they're so motivated by. They're motivated. I mean, that's their entire lives. They pay their entire lives to hit different goals, right? It's to play high school, then it's to play college, it's to play pro, then it's play at a high level at pro. And our goal is to help them stay in the league for as long as they want to stay in the league. And so some of our guys one guy's on their 9th year. So how do we ensure that they can play? Their goal is to play 10 years in the league. Okay, how do we ensure that? And what does that look like?
Yeah, and I think it's absolutely wonderful that both of you were saying these things, and that itself elevates our profession forward too. Where it's such a unique trait that we are at a place where we have data, we have clinical technology, and then we have athletes and patients that pursue our care. But then to be able to propel our field forward so that we get recognized as this profession that actually allows individuals to play for 10 years if they want to, or play at a higher level if they want to, or be able to recover using the best available evidence. So I think that's where it's at. So thank you for sharing those. Those were absolutely wonderful. So with that in mind, I would like to leave the last piece of information from you guys. So is there anything you would want to share with our audience, or with a greater audience in general, that you think would be of value to both you guys and then to our community?
Oh, I get put on the spot first. I guess my biggest thing, I think just in general, I think one of the things that we're so passionate about and why we kind of broke off and started our own clinic and decided to go down this route is just how passionate we are on collaboration and, pushing this field forward, because it's like we were saying earlier, as this field has grown, there's, I've been practicing for 15 years, documentation requirements and what it looks like, and how you start to get down this path of, you have to do this and you have to do this. And all of a sudden this paperwork and why we went into PT is starting to kind of go away from the why, right? Is, that's what we're so passionate about, is continuing to elevate this career and continuing to elevate and show our patients that we're not just a person behind the computer screen, that we are truly passionate about changing their lives and being a part of their lives and being a part of their career for, some of these guys we've seen now for multiple years, to ensure that they stay healthy. But then also collaborate with so many people, right? We collaborate with the SPRY team, because how do we ensure that our documentation is helping each other and is helping be efficient and helping our patients and helping our front desk? And then as well as how are we helping communicate with our sports performance team and those types of things. And so I think what I'm so passionate about is moving our profession forward and continuing that, even as challenges happen and reimbursement happens and, and all of those insurance, stipulations and all those things are changing, that we still continue to have the passion of our why, and why did we get into this career, and the patient was the center, right? And we love what we do, and how do we ensure, and how do we use technology, and how do we use data, and how do we use research to keep moving this profession forward so that we keep that patient at the center.
Yep. Yeah. And I would say, I think one of the big things for us is our mission and our value is to always be evolving. And that's kind of, it's on par with technology. And it's part of the reason we chose SPRY is we wanted a healthcare system, a technology that could evolve with our needs. And so I think that's where we found the most value out of SPRY is that y'all have truly taken everything that we've said, hey, we need this to happen, and have found ways to make it happen, whether that be with your EMR system, your AI software, whatever it may be. It's truly been one of those things. So, I think a shameless plug, I would say, follow us at Athlete Restoration Lab on Instagram. And, I think one of the things we'll be showing is how we utilize SPRY and other technologies to truly meet our athletes' needs. So, I think with that, I would just say, thank you to the SPRY team and yourself and allowing us this opportunity and allowing us to truly, I think, help to make the PT world, and especially in the sports world, a little bit better.
Thank you, guys. And I have no reservation to say that if athlete at any level, if there's ever a need, that we should absolutely come and see you guys and be both your patients and follow you guys. So thank you for this, and thank you for all the information, and thank you for all you do with the patients. So this has been great.
Thank you so
Thank
much.
you, Alex.
Appreciate it.
Yeah, you guys are awesome. And I think by far every piece, and I think this is outside of the podcast loop, right? You are practicing on that like 0.1% of the PT license. So I think you need to continue to do that, because it's ideal, and more people will follow you on Instagram or wherever, and then we'll get inspired, and then we'll actually start to do the same thing. I think it's so important for our profession to emulate what you guys are already doing. So thank you for this.
Thank you. Appreciate it. We really
Thank you again.